More businesses in Texas are reopening as the pandemic continues to impact us here in the Lone Star State.
Governor Greg Abbott is standing by, joining us live in Austin as we continue to talk about the future of the state's response to COVID-19. Governor Abbott, again, thank you for joining us.
My pleasure. Thank you so much.
And by talking about the recent surge team that has been sent here to the Panhandle, do you and state leaders feel like we're getting a handle on the number of cases?
You know, we have seen the numbers over the past 2 weeks, and you all saw the spikes that were taking place, largely because of what was happening at these meatpacking facilities. And then you saw local government leaders as well as state legislators get involved and work on responding to that. And then 2 weekends ago, we sent in a CDC team, a team that was authorized and supported by the Vice President. We sent a team from the state of Texas, including the Texas Division of Emergency Management, as well as other teams, a surge team to test more people, but more importantly, to isolate those who test positive from those who test negative so that we can begin to cordon off the spread of the coronavirus. And the results speak for themselves. It seems like on a daily basis, the numbers of people testing positive gets lower and lower. The effort is not yet complete. However, the progress is very substantial, and it shows what can be done when we apply the resources that are needed to respond to an outbreak of COVID-19.
Governor Abbott, let's go ahead and stay on that subject. What have we learned about our spread and how that's affecting those rural hospitals as we kind of move forward through this?
So what we've learned is that the spread of the coronavirus has some hot spots in the state of Texas, and there are 3 areas that we're focused on to be very responsive to as we begin to open up business in the state. One are nursing home facilities and senior living facilities. 2 are meatpacking plants. And 3 are jails and prisons. If we control those 3 areas, we will be able to slow the spread of the coronavirus and be able to far more effectively open up the state of Texas, while at the very same time, by going into those senior centers, we will be reducing the number of fatalities in the state of Texas also.
Governor Abbott, we do want to ask you about that directive that you gave today to test every resident and staffer at Texas nursing homes and long care facilities. Can you give us more specifics on exactly how that would be done?
Sure. This is in the aftermath of a telephone conference that all the governors had with the Vice President and with Dr. Birx early today. One thing we all know is the population that is highest at risk for the most dire consequences of COVID-19 is the senior population, especially those in nursing homes. Our goal is to reduce the spread of the coronavirus while also reducing the death rate. And the way to do that is to surge testing in all senior living facilities and nursing homes across the entire state of Texas. And combined with that is additional testing capabilities that's being provided to Texas today by the federal government, so that we will be able to complete this exercise of testing all senior living facilities in Texas over the coming weeks.
Governor Abbott, phase 2 underway. What benchmarks are you looking for in order to allow us to move into that next phase? And then what will that next phase even look like for the businesses here in Texas?
So there are several benchmarks that are the most important benchmarks. One is the positive test ratio. What that means is the percentage of people who are tested who test positive. That's important, but candidly, the 2 most important are these, and that is, what is the hospitalization rate? Because it's one thing for a person to have COVID. It's another thing for it to be serious enough that they have to go to a hospital. The good news is, just over this past day, there are more than 100 people fewer in hospitals today than there were yesterday. And we've had for about the past 4 or 5 days or so a downward trend in our hospitalization rate. So that is a good sign. The other thing is that fatalities remain at a low level. Texas is one of the best states in the United States for having a low fatality rate. If we can maintain those 2 standards and do what we're doing with regard to the senior population and help protect those in nursing homes, we will go a long way toward taking the next step to make sure Texas will be able to expand the opening of business in Texas.
Governor Abbott, I want to ask you just quickly, while we have this time, what's being done in our jails and our prisons to make sure that that population is staying as safe as possible?
Sure. Several things. One is we're increasing testing in jails and prisons, and then we're separating those who test positive from those who don't, so that those who are not testing positive will be free from COVID-19. And then we're providing the treatment to those who are testing positive to make sure that they get the kind of care they need.
Governor Abbott, we cannot thank you enough. We know that your time is valuable, and these moments where we get to check in with you in the live interview for you to be able to talk to the people of the Texas Panhandle and of the High Plains, we certainly appreciate it.
It's my pleasure. Thank you all so much. Be safe.
All right. Thank you. You too.
Thank you, Governor. Go to myhighplains.com for more facts, not fear, during this pandemic.